guys, do you know what is osteoarthritis?
Osteoarthritis, the most common type of joint disease, is a chronic degenerative arthritis which is identified by articular cartilage degeneration, changes of the underlying subchondral bone, and widespread remodeling of surrounding bone, with new bone resulting in osteophyte formation and synovitis.
Osteoarthritis is a part of normal aging process and it is not a serious health problem.
Wait, this is wrong. The fact is,
The pain will make harder for you to perform your daily activities and it is not normal part of the aging. This is the classification of osteoarthritis. Arthritis divided to primary and secondary. Primary type largely due to wear and tears over time. It is associated with aging and people tend to develop this type if at age 55. Secondary caused by other conditions that damage cartilage, for example like trauma and congenital joint abnormalities. It tends to appear in relatively young individuals. Now, the prevalence of osteoarthritis in Malaysia and also global.
Prevalence among elderly in Malaysia. Knee pain was present in 30.8% of the population. Prevalence of OA symptoms was also higher among ethnic Malays, second, Indians and lastly, Chinese. The pooled global prevalence of knee osteoarthritis. 16% in individuals aged 15 and over. 22.9% in individuals aged 40 and over. The global incidence of knee OA was 203 per 10,000 person a year among individuals aged 20 and over. No significant difference in rural and urban. The highest prevalence in global. Firstly is Africa, Asian, North America, Europe, South America, Oceania. Osteoarthritis. More likely among women compared to man.
But what is the clinical features? The clinical features is loss of flexibility, pain, grating sensation, bone spur, tenderness, and stiffness. This is maps of health condition according to ICF. Commonly, patient will have issue in body structure like pain, inflammation, joint stiffness, and limited ROM. So, patient will have limitation in ADL, IADL, work, and also leisure. It also affects participation in family relation, social community, work, and also sport. Environmental and personal factors also interrelated to this health condition.
Next, we move on to frame of reference. Biomechanical frame of reference is a remedial approach focusing on impairment that limit occupational performance. The goals are to prevent deterioration, to maintain existing movement, to restore movement, and lastly, to compensate or adapt for loss of movement in occupational performance. Meanwhile, rehabilitation frame of reference is a process of facilitating patients in fulfilling daily activity and success roles. The client must focus on remaining abilities and it use the method of teaching client compensatory or functional method and make use of assistive equipment and environmental modification to restore function. So, what is occupational therapy roles in patients with osteoarthritis? The first intervention is physical agent modalities. The American Occupational Therapists Association describes PAMs as equipment including superficial thermal agents, electrotherapeutic agents, and mechanical devices designed to assist patients in their daily life. PAM is a preparatory method aimed to reduce pain, inflammation, and muscle tension, and other than that, to decrease joint stiffness. Some examples of PAMs include cold pack and physiotherapy. As for grading, therapists can increase time or duration per session and also increase electrical input for device that is electrotherapeutic agents. The second intervention is aerobic and strengthening exercise. Recent recommendation for treatment with osteoarthritis has suggested exercise and physical activity as first-line treatment to reduce pain and improve function. The aim of aerobic and strengthening exercise is to relieve pain, strengthen muscle, and reduce joint stiffness. To implement the activity, therapists must first clarify and demonstrate procedure of each activity. Here are some examples of aerobic and strengthening exercise. Next, therapists also can grade the activity by increasing the intensity, time, and frequency. The next intervention is joint protection and energy conservation technique. This technique are self-management approach that teach ways of doing activities so that the risk of deformity is decreased. The aims are to reduce pain, inflammation, and excessive stress on affected joint. Here are some of the techniques of joint protection and energy conservation. The fourth intervention is orthosis and adaptive device. Using this may help patients to reduce stress on a joint by shifting weight of the joint. The aim of this intervention is to assist patients to limit stress put on the joint. Here are some of the examples of orthosis and adaptive device. Research also has shown the effectiveness of using assistive device and orthotic in patients with osteoarthritis. The result reveals that patients have improvement in occupational performance and quality of life. The last intervention is environmental adaptation. This can be done at home or workplace. The aim is to reduce environmental barrier in order to encourage the patient to participate in his daily life activity. Here are some recommendations for environmental adaptation. To conclude, occupational therapy plays an important role in managing patients with osteoarthritis. The goal is to maximize patient ability to participate in occupation, to promote safety, and to enhance the quality of life.